Welcome back. Thanks for staying with us. The Limpopo Health Department has condemned the assault of a nurse at a clinic in Tzaneen. The patient allegedly skipped the line, demanded to be attended to. When he was asked to wait like everyone else, he attacked the nurse. The suspect has been arrested. For more on this, we're joined by Dr. Phophi Ramathuba, the Limpopo Health MEC. MEC, very good afternoon to you. Thank you for your time. A frightening revelation, a nurse who was consulting a patient being attacked. What actually happened?
Good afternoon, Mpo, and afternoon to all your viewers out there. What we can report is that the preliminary investigation and the allegations that we received was that in terms of there was a professional nurse who was consulting a patient in a consulting room when another male patient stormed in and demanded a note. We further discover that this male patient is a worker who did not report on duty and decided to go to a private pharmacist for self-medication. And unfortunately, the employer needed a sick note. Instead of him to come and consult, he just stormed in and demanded. When the nurse tried to explain that she's still attending to another patient and he is invading the privacy of another patient, that's when he started assaulting her, and she ran out of the consulting room, and the security guards came in and rescued her from him. As it is for now, we admitted her in one of our facilities, especially looking at her condition that she is 17 weeks pregnant, and we were just worried about the health of the baby and also for her. But what we can report now is that they are both stable. Although psychologically this is going to have a serious impact, not only on her, including all the colleagues that they are working with them. We requested our district manager to immediately go to the clinic because this is one of the clinics that on Tuesday, when I was tabling my budget vote, because infrastructure we have improved and we have added more nurses, we have even put a new palisade fence. It was ready to be activated to start operating 24 hours from the 1st of May. But now there's going to be one professional nurse short. We will have to, for obvious reason, she will have to be reallocated to another clinic. The worst thing is that she doesn't come from that particular area. Therefore, she has indicated she would prefer to work in a village closer to her home, which we would have to respect that. But what the implication means, the community around Relela that is dependent on that particular clinic for healthcare services, they will have to wait for another batch of nurses when we advertise posts, which we do not know how will we attract them, because when you are known as a community of assaulting and attacking health professionals, even health professionals talk amongst themselves and they do not prefer your clinic or your facility to work in. Everybody would want to work in an environment where they know they are respected. But we want to appreciate that after activating the police, he was then arrested, and the community, even I'm told throughout the weekend, they've been there at the clinic and trying to support the staff from the clinic committee point of view and the local leaders to say they are also worried about what has happened, noting that not so long ago in the past week, not far from that area, Madumane village, where another professional nurse was assaulted there, raped, and left for death when she was in a taxi coming back from home to go to work. And unfortunately, her condition was more serious than this particular one. So it has become a problem for the greater Tzaneen municipality and the villages around Tzaneen to say, what is wrong with us as communities when we just go on attacking those that are supposed to save our lives when indeed we are in need of healthcare services.
Absolutely. Very shocking indeed, MEC. So talk to us about the suspect that has been arrested. When is he expected to appear in court? And also perhaps answer to the second incident that you speak of. What charges are being followed up through there, and when is that going to see its day in court?
He was arrested on, if I'm not mistaken, Friday, or if I'm not mistaken, like I've indicated, the district manager will be following up on that case tomorrow so that we can hear when is he appearing in court. He is a known patient around that particular area. So we will have to be guided by the law as to what next will happen. But as a department, we are going to be providing full support, as we've already started, for our employee health-wise, and also her mental health. We've already started with psychological assistance. We are also providing support on the other staff. So we will be following that particular case very closely, making sure that even our team, when he appears in court, they will make sure we are there to really make the law to see that unless we set an example with one, we are going to have innocent people being deprived healthcare services. We have got to isolate criminals and make sure that they are punished harshly by the law, so that innocent people who want healthcare services do not get to be disadvantaged by a few rotten apples that are there amongst our community. The other case that I've indicated of Maduman, equally, this is a clinic which on Tuesday when I gave the budget speech, I've already withdrawn it from a list of those that were supposed to start on the 1st of May. Now it's going to be 2 clinics that are now being withdrawn from starting on the 1st of May to provide 24-hour fixed service. Because this is another clinic that has shortage of staff. On the 1st of April, when we appointed professional nurses, 278 of those nurses were allocated in clinics. Those clinics that we earmarked and identified that in the areas that they are located will require them to operate 24 hours. We put a lot of resources on that particular clinic, including this one, Relela Clinic. Now, this is one of the professional nurses who just started on the 1st of April to work in that clinic. And she stays in another district, far from that area. She went home for the long weekend. On her way back to work, you will understand that moving from one village to another, you will have to change transport from one taxi to another. Unfortunately, the taxi arrived, the last taxi she used arrived in that village around 9:21 hours. She pleaded with the taxi driver to say, I am new in this area, I'm going to the clinic. Can you please do me a favor and drop me at the clinic because I don't even know this area. Unfortunately, the taxi driver trusted the fellow who was part of the passengers, who said to her, I'm from here, I will take you there. You say you are a nurse, I'm going to protect you. Instead, this is the very same guy. Immediately he grabbed her into the bush and raped her, assaulted her. She even sustained fracture. And that's why she was left to death until she crawled up to the nearest household where they did open. When they hear that it's a woman who is a nurse, they call an ambulance and she was admitted. So equally, when she recovered fully, we are not going to take her back to that particular area. What does it mean? It means the local people are going to suffer. They will have to wait for more months before we get another nurse to replace her for that clinic to operate 24 hours. We are raising this because we are saying this is not just crime. This is a crime that is targeted to critical skills that we have, people that the very same village needs the most. And these criminals are our sons, that's to stay that we have given birth to. These are our brothers, our uncles, our boyfriends. We stay with them and we know them, but we don't want to come up front to help the police. We still made a call for the community around Matuman and the taxi driver to say come and help the police to identify this criminal, because if you don't do that, our nurses are still working in fear. The community is still worried about there's a criminal among them who might terrorize another person, because once a rapist, you will continue to rape others until you are arrested and justice is served. And unfortunately, if we don't help the police, we are going to make it life difficult for the Department of Health to provide services that the community needs. Community must understand the clinics is the closest healthcare service source that they can have. And if we don't have clinics that are fully functional and operational, coincidentally, as a department, we declared this year the year for primary health care, because we know the sufferings of our people when they will have to get money for transport to hospitals for minor ailments which can be dealt at the local clinic. But when this is our staff are being terrorized, it becomes very difficult.
Yeah.
Somebody might ask, what is security doing on that? But if you look at these two incidences, we might want to blame security or government, but the reality is that this is a situation where the blame is put on community, society, criminals. It cannot be the Department of Health. We have put up infrastructure. We've put up full-time security. It's impossible for a security guard to be sitting with a nurse or a police to be sitting with a nurse when the nurse is consulting. Mm-hmm. We must still respect the privacy of our patient. So a nurse and a patient must be given that priority and that confidentiality. Patients will not agree to have a security guard standing when a nurse is examining you. It cannot work like that.
MEC, we just veering off slightly. We know that we've just heard, of course, this weekend that there is no end in sight for load shedding. It will not be done and dusted with in December of 2023, as had initially been said. So I know that you've been hard at work trying to beef up backup generators. And of course, there's been a lot said about what happens to levels of crime during times of load shedding. How far are you, and how much consideration in your budget is there for ensuring that when load shedding does strike, and if it ends up at stage 8, that hospitals are indeed covered and patients are not at risk, as well as staff?
As it is for now, what we can indicate is that all our facilities are equipped with reliable backup generators. You remember previously we have indicated that we did an audit in all our facilities to check in terms of the reliability of the generators. Most of them, we found them, they are tired. They're continuously experiencing breakdowns, because these are generators which, when we procured them, we were not looking at stage 6 or 8 load shedding. We were looking at them being standby generator for that 30 minutes in case there could be, for whatever reason, a power failure, because hospitals can never have an interrupted power supply. So with that part, we have done well. But the problem here is that generators, to sustain them, it's very expensive, because not only you're talking about the fuel, that diesel is expensive, there's also a price inflation by service providers. That's why now we had to even get a contract for that, because when hospitals themselves were procuring diesel, you will find each other hospitals, the prices were shocking and scary. So we have now, as part of mitigating and also reducing that exploitation, look into the contract that will look at a flat rate that we would use when we procure diesel, but also maintenance, because in the past, maintaining generator, you could do it once a year. But right now, because in a day, a generator can work up to 4 to 6 hours, because when the power goes out for 2 hours and again another 2 hours, whether it's midnight or it's during the day, the generator must operate. In other sectors, maybe at night you might say people are sleeping. At the hospital level, 12 o'clock midnight, that's when babies are born. That's when emergency operations must be done. The ICUs cannot be switched off. Our casualties are busy. So that's one part. So we are also looking at alternative ways, wherein we have started to even consult the Minister of Electricity and his technical team to see how they can assist us in terms of looking at solar power supply, solar panels in both our clinics and also our hospitals. So that is work in progress. We have now also identified 100 clinics where we are currently piloting the inventors where we could look into. So there's quite a lot of work that we are doing, because looking at the failure or sustainability of relying on generators due to fuel, to say at least the generators will come in handy at night and also during winter when you don't have sun. But now during the day when you have a sun, the good thing is that Limpopo is one of those provinces that is blessed in terms of the sun. So we can be able to use the solar energy, and we can be able to have that as a part of supporting the alternative way, so that the hospitals do not have to suffer during the shedding. But as it is for now, we can reassure you that we even have other generators. We've just procured another 19 of those. There are some that are in head office. There are some that are in a district office. Why we did that is to make sure that should you have an unexpected breakdown of a generator, and we know the demand currently is making them not to be easily available on the market, and therefore you even to get their parts, you will be told it can take up to 14 days or even a month to get the parts. So when you have a standby, and these are big generators, 500 kVAs up to 800 kVAs, that we say if in case you have that breakdown, yes, while you're still waiting for the supplier, you can take that mobile quickly to that hospital so that it keeps the hospital running.
Very well. Thank you so much. Let's leave it there for now, MEC. Thanks for your time, Dr. Phophi Ramathuba, Limpopo Health MEC, giving us a breakdown on some of the latest developments in hospitals across Limpopo. We will